Online with me is the director of Fortis LaFemme Bangalore, Dr Prathima Reddy. Good morning to you, Prathima.
Morning, Prithvi. How are you doing this morning?
Super.
Prithvi, Bangalore ka bond.
So, Dr Prathima Reddy, MBBS, MRCOG London, FRCOG London, FACOG USA. Now, what does this mean? I have no clue.
Well, I've got all my degrees from the United Kingdom and from the USA. That's all it means, Prithvi. Nothing more than that, nothing less.
But what is MRCOG?
It means Member of the Royal College of Obstetricians and Gynecologists. FRCOG is Fellow.
Oh.
And FACAG is Fellow of the American College.
Fancy. Awesome. Okay, thank you for your time this morning. You're also a senior obstetrician and gynecologist. I want to ask you this, Dr. Prathima Reddy. How does COVID-19 affect pregnant women?
So COVID-19 affects pregnant women almost like it affects everybody else. And what we know from research that's come out of China, because remember, this is a very new disease, right? We're just 5 months into it.
Right.
Says that by and large, unlike the other viral diseases, it doesn't affect pregnant women any more than you or me.
Super. That's a relief. Because I recently read a piece of news that a COVID-19 affected mother gave birth to a baby which was free from COVID.
Yes.
Yeah, super.
And that is one of the reassuring things. Yeah.
Awesome. So what are the precautions that pregnant women otherwise need to take in the present pandemic?
So it's the same as each one of us, Prithvi, in that, number one, wash your hands frequently with soap and water for 20 seconds. Very, very important, 20 seconds.
Yep.
Number two, social distancing, which is a minimum of 6 feet. I say 7 feet because if I say 7 feet, then, you come up to 6 feet. Yeah?
Yes.
Yeah, absolutely. And make sure that you don't socialize. Virtual socializing is fine, but you don't socialize with people. Keep away, keep away, keep away.
Super. That's Dr. Prathima Reddy, the director of Fortis LaFemme Bangalore, senior obstetrician and gynecologist, and also the chairperson, Medical Council Committee, Fortis LaFemme. We'll be right back. Online with me is Dr. Prathima Reddy, director, Fortis LaFemme Bangalore.
Prithvi, Bangalore ka bond.
Senior obstetrician and gynecologist, and also the chairperson of Medical Council Committee, Fortis LaFemme. So, Dr. Prathima Reddy, what are the measures that you have put into place at LaFemme to reduce the risk of transmission of the virus, COVID-19?
So basically, Prithvi, we take this whole thing of keeping our patients, our staff, and the hospital safe very, very seriously. We've got a COVID task force in which the key clinicians are sort of working day in and day out, trying to keep up with this disease. Because remember, every day there's a new thing about it.
Yep.
So what we have done is basically a very strict screening process. There's only one entrance to the hospital now. You come in through that and you exit through another door. At the entrance, there's a questionnaire that you fill, your temperature is checked, and any doubts, the nurse speaks to the doctor and you're screened at the door itself. Yeah?
Brilliant.
And with regard to the staff, everybody's got their protective equipment. In fact, the ICMR has put out what we need to use at each level, but in fact, we have gone one step ahead and we're slightly ahead on that protective equipment business.
Awesome.
Allow attenders to come in, so that restricts the spread of disease from asymptomatic people. So these are all the various things that we're doing. So we ourselves are maintaining social distancing. My nurses, doctors don't come anywhere less than 6 feet in front of me. So we're all far apart, of course, which means we shout at each other nicely, not violently. But that's how it is. Yeah.
Super. That's Dr. Prathima Reddy, the director of Fortis LaFemme Bangalore, the chairperson of Medical Council Committee, Fortis LaFemme, senior obstetrician and gynecologist. I am Prithvi, Bangalore ka bond on Fever 104 FM. Good morning.